It's really great the way next generation sequencing has come along, and I think it's wonderful that we now have 4 laboratories that offer this in the UK, well, in England anyways, and we're working really well with the 4 laboratories so that we can all be doing the same thing in the same way. And the information is coming to the clinicians much more readily about when it's appropriate to be doing these tests. And I think what I'm looking for in the future is that for people to use it a little bit earlier in the diagnostic process. And part of the problem is that it takes 3 months to get an answer. So it's very frustrating for the clinicians and for the patients that they have to wait 3 months to get the answer, especially because it's not for a technical reason, it's purely because we don't have enough staff, and we could really do it in 3 weeks if we had enough staff. But leaving that aside, I think going forwards, we could be doing this test in more individuals. And I've seen, as for example, a few pregnant ladies who are a little bit more anemic than you might expect, and they don't get diagnosed until maybe their 2nd or their 3rd pregnancy. But if somebody had thought about it earlier and done the genetic test, they could have had a diagnosis much earlier. And the other thing that I think needs to improve is clinician understanding about some of these genetic results and what they mean, and in particular what we call variants of uncertain significance. So there's a lot of education happening at the moment, which is happening through the BSH, but also through other organizations, so that clinicians can be really up to date with understanding what the genetic results mean.